Was COVID challenges in rural areas and how Western Maryland healthcare providers are responding to the challenges of COVID-19 in their communities. And we're very excited to have 3 presenters from Washington, Allegheny, and Garrett counties in Maryland. So this will be very exciting. I am Lisa McCoy, and I'm a University of Maryland Extension educator and part of the Excite grant team that we also share this Excite with the University of Delaware, this grant that we have. And I will be one of the moderators today, and the other moderator is Crystal, and I will let her do a brief intro.
Hi, everyone. I'm Crystal Terhune. I'm also a family and consumer sciences educator. I'm located on the other side of Maryland in the Midshore region, covering Caroline, Talbot, and Dorchester County. I'm also part of the Excite team, and I'm handling the questions today. So if you'd like to enter any questions in the chat box, you can send them directly to me, and I'll be more likely to see them, or we'll have a lot of people looking out for the questions in the general stream as well.
Great, thanks, Crystal. Yes, and I'm actually, as Crystal said, I'm on the other side. I cover the 3 Western counties in Maryland is my area that I'm covering for that. So let's move forward. So if you're not familiar, are we recording this, Amara?
Yes, we are.
Okay, good. So I just want to quickly share what the Excite project is if you're new and have not been to our previous, any of our other ones. So Excite stands for Extension Collaboration on Immunization Teaching and Engagement. Much easier to say Excite, right? And this is actually funded by the USDA National Institutes of Food and Agriculture Division, which is a collaborative effort of land-grant universities and the cooperative extension system. And the funding came from the CDC for this, but it was trickled down through USDA. And the goal of it really is to improve vaccination coverage and to strengthen education on immunization with a special focus on adult vaccine hesitancy around both COVID and other adult immunizations. So our immediate goal of our project is to promote the uptake of COVID-19 vaccinations through messaging that is science-based and some innovative models for community action. So we received this grant last year, mid-year, and one of our grants, we have 2 grants. One is ending this year. The other one goes into 2023. And as I mentioned, it's the University of Maryland Extension and the University of Delaware Cooperative Extension are jointly on this grant that goes through next year. So our plan for today is we have 3 presenters, healthcare providers. We have Cindy Earle from Meritus Health in Hagerstown, Maryland, in Washington County. We have Janelle Mayer, who is with the Allegheny County Health Department in Cumberland, Maryland. And then we have Kendra Sayre, who is with Garrett Regional Medical Center in Oakland, Maryland. So we're really happy to have all 3 of them to share with us a little bit about what they've been doing, because we know it's been challenging in rural communities with the COVID-19 and especially in Western Maryland. So we are anxious to see how their presentations and to hear what they have to say. I'm going to stop sharing my screen, and I'm going to introduce Cindy while she's loading up her presentation. So I'm really pleased to introduce Cindy. Cindy and I have been great friends and colleagues for many years and have worked together in Washington County. She has a master's in public health. She has her BS, and she's a registered nurse and also a community health education specialist. She's the manager of community health services at Meritus Medical Center. And under her leadership, the Meritus Mobile Vaccination Clinic was established in response to the COVID-19 pandemic. She is currently serving on the executive committee of Healthy Washington County and is a past member and president-elect of the board of directors of the Washington County Commission on Aging. Cindy has had over 32 years emeritus, and she's received the President's Award several times, and she was the recipient of the Pledge Award for employees that exceed expectations and uphold the core values of the hospital. She's passionate about creating services in which every person has equitable access to healthcare and is looking forward to meeting the need through their mobile health services at Emeritus. So Cindy, are you able to share your screen?
I'm having trouble
Okay.
getting to my files.
Oh, okay.
Let me see. I don't want to leave my meeting.
Can you go to the email and just email me the presentation?
Yes, I can. Let me see if I can even maybe I can get to it this way. Hold on. I'm sorry. Just give me a moment.
Okay. We could move on to Janelle and then we'll come back to you, Cindy. How would that be?
Let me, hold on. I was just sending it to you right now.
Oh, okay. All right.
Hold on. Tell me if you get it.
I'm not seeing it. No,
Okay.
I'm refreshing.
Did you get it?
No,
Nope.
something is blocking it. I'm not sure if it's
Yeah.
yours or mine. It's hard to say which one. Looking in my spam folder and it's not there as well. So, okay, why don't we, we'll go on and,
Yeah, Janelle, are you able to go ahead and go now?
Sure,
yeah.
Okay,
sure I can.
super.
Then
All right,
we'll
I'm
come
going to try to share as well.
Okay, well, while you're doing that, I'll go ahead and do your introduction.
Sure.
So Janelle Mayer is a Master of Public Health, and she is the health officer at the Allegheny County Health Department. In her role, she is responsible for protecting the health of Allegheny County residents and overseeing the many programs and services that the health department provides. She's been with the county health department for 10 years, first in the community health department and then as the health officer. Prior to moving to Allegheny County, she did health policy work at the Maryland Department of Health and for a nonprofit organization in Washington, D.C. So we're very glad to have you, Janelle, and look forward to hearing all your great insights.
All right, thank you, Crystal. Thanks for having me. Can everybody see my slides?
Yep.
All right, okay. So first, I just wanted to start off talking a little bit about Allegheny County and who we are and who we serve. So Allegheny County is in Western Maryland, we all know, and its land area is very large, and the majority of resources are focused in Cumberland, which is in the central region of the county. So a lot of health resources are there, the Allegheny County Health Department, the hospital, most doctors' offices, and then you have some of these outlying areas like Westernport, Lonaconing, Mount Savage, which have limited resources and also limited transportation options. Transportation is a big barrier in Allegheny County. We have a very limited public bus system, and we have 11% of our households in the county do not have their own private vehicle. So that creates a barrier for a lot of families to getting to health resources, including COVID vaccinations. We also have, our county tends to skew older. We have more seniors than most counties in the state of Maryland, and we have a lower household income on average than other jurisdictions. So our challenges during the vaccine rollout, back in the beginning, we had high demand and limited doses of vaccine. We also had limited space. It was a challenge to try to find a space that could accommodate 600 or 700 vaccinations a day. We had the eligibility criteria that were coming from the state of Maryland. That created challenges when people really wanted to be vaccinated and it was not yet their turn. We know that it was based on age and also employment in the beginning. So that was a challenging time. Access was also an issue, especially in the beginning. Now we look around and we have COVID vaccines available at every pharmacy, in the grocery store, at primary care providers. You can find them in many, many places in Allegheny County, but that was not the case in the beginning. Access was a big issue, especially in some of our outlying areas. And then again, transportation, always a big challenge in our county. So we put several strategies in place throughout the course of the pandemic. Many of these are still in place. In the beginning, we set up a nurse call line, and the purpose of that was for people to get their individual questions answered about the vaccine. People had questions about their own health conditions, their own health history, what the vaccine might look like for them, where they are on the eligibility list, how do they sign up? And that nurse call line was very helpful. We had our school nurses who were out of school addressing those questions. They sat and answered phone calls all day from concerned Allegheny County residents who really wanted to know more about the vaccine and what was right for them. We also had our senior center was one of our great partners, and they agreed to take calls and make appointments for seniors. So these were there are trusted relationships there with the seniors in our county and the senior centers. So they could call and sign up for a vaccination, have their questions answered. Putting information out to the public, we've used some of our standard communication tools like press releases. We've been doing 3 times a week press releases. We continue to do that. And that goes to our local radio stations and our newspaper, out to places like WCBC, and we also put information out on social media. A lot of that is to try to, things are always changing when it comes to the COVID pandemic and vaccinations. We want to get information out there about where people can go, what dates and times we're offering vaccination, also to try to counteract some of the misinformation that is out there about COVID vaccines. We, in the beginning, set up a mass vaccination site. It started out at what's called the Rawling Shell Building, which is a large empty industrial building down in Rawlings, which is south of Cumberland. It was just a lucky thing that this space was big and empty and owned by the county, and they were willing to let us use it. It had plenty of parking. And that helped us overcome our barrier, which was space and a place to vaccinate. And then as our numbers decreased, we moved up to the Allegheny County Fairgrounds, which is just north of there. We have and continue to have specialized clinics at the health department. So this is for smaller groups. Right now, we're doing the 5 to 11 age group at the health department, which we think that a smaller setting is more comfortable for that age group. And we've also done the 75 and older group down there, certain health conditions we offer at the health department rather than a mass vaccination site, which is not the greatest setting for all populations. We sent nurse teams out to assisted living and independent senior living facilities. Our nursing homes were all vaccinating their own residents, but the assisted living and independent senior living facilities were not included in that. So we sent nurse teams out to vaccinate and then back 4 weeks later to do second doses. We did fire hall clinics. Fire halls in especially some of the smaller outlying towns, they're really like a social hub, and everybody knows each other in some of these smaller towns. And they are a trusted source of information. They're a social gathering place for people. And we partnered with them. We had some of our staff who live in these smaller communities go out and promote our vaccination clinics. So they had printed out postcards that were specific to their hometown, and they went out to the corner store and the bingo hall and some of other places where people gather to promote the vaccination clinics at the fire halls. We did school-based clinics, and that again was to bring vaccinations to some of our more outlying areas and offer them in a setting that people were comfortable with. Parents and kids are comfortable in these schools, they're their hometown schools, and it helped us get out and provide vaccines in different areas of our county. We offered vaccinations at community events like Juneteenth. And then we also work with our local providers to try to make it as easy as possible for as many local providers to provide vaccine. We know that there's a trusted relationship between people and their doctors, and maybe a member of the community who would not come to a mass vaccination site or doesn't want to be vaccinated by the health department, they may be willing to meet with their primary care doctor who knows them and be vaccinated at that site. So what we do is we store vaccine for local providers. When a provider orders vaccine, they order hundreds at a time, and some providers don't have that great of a demand, so they want 20 doses, 30 doses, 50 doses. And so we serve as a hub for vaccine and provide that to some of our smaller providers so that they can vaccinate members of our community as well. And we also have ultra low cold storage, which allows us to store Pfizer vaccine. So here's a map of some of our vaccination clinic sites. The red dots are our fire hall clinics. And you can see we went out to some of the areas that really have transportation challenges, access challenges, and we brought the vaccine to them and provided it in a setting that is comfortable and just around the corner. The blue dots are our school-based clinics. So again, we tried to spread those out throughout the county and make vaccine available. The green dots are our regular standing mass vac sites. So we have the health departments on there, which offers vaccination ongoing. The fairgrounds, which we're still vaccinating every Wednesday. It's co-located with our testing site. We have a drive-through testing site there. And we're also offering vaccinations on Wednesdays. And then the Rolling Shell building, which is now decommissioned, but was great for us while we were vaccinating there. A lot of the challenges and the strategies, we really work together with our community partners, and that was so important for us to get things done in our small rural area. It's really important that we work with our partners, and we have great partnerships here. UPMC Western Maryland is the only hospital in Allegheny County, and they have been wonderful to work with from the start. In the beginning, we were sharing a registration list of patients who were interested in being vaccinated. We were coordinating who was holding a mass vax when, and working together very closely to try to reach as many people as we can with our limited doses. Allegheny County government has been a wonderful partner. They provide the fairgrounds and they've provided the Shell building. Our senior centers were wonderful. They took calls from seniors. They have these established relationships. They even would bus seniors out to get vaccinated to try to get over that transportation barrier. Our assisted living and independent senior living facilities allowed us to come in and vaccinate our fire departments, community organizations, again, private providers. And another really important partner has been medical assistance transportation. So medical assistance recipients, many of them have a transportation benefit, which allows them to be transported to medical appointments. And we worked closely with the program to ensure that a vaccination is just as important as any other medical appointment, and they can use their medical assistance transportation benefit to get to whether it's the fairgrounds or UPMC or the pharmacy. we worked to ensure that that was available. We do have a lot of individuals who have medical assistance in Allegheny County. So we do have some ongoing challenges that I think are not unique to Allegheny County, but strong in Allegheny County. Our largest challenge is, I think, misinformation. There's a lot of information out there, whether it's on social media or it's something you heard from your neighbor or heard a story about your neighbor's friend. There's a lot of information out there that we're trying to counteract with, scientific data. We want individuals to look to trusted sources like the CDC and the Maryland Department of Health for information about the COVID vaccine, and their physician. That's a really important relationship too, or even their pharmacist. We want people to go to those trusted sources, and it's fighting off the misinformation is not easy. That's definitely been a challenge. We do have some newly hired community health workers that we hope can be some more boots on the ground to go out and talk to people about COVID vaccination. The group that is left that has not been vaccinated to this point, it's a tough group. It's a tough group. But we're not giving up. We're still working to address access and transportation issues, make it easy for people to get vaccinated, but also to want to get vaccinated. And another challenge is the distrust of government, which I think is pretty strong in our county. As a government agency, that's been really a barrier for us, that if individuals distrust the government, they're distrusting what we're saying, what the CDC is saying, and holding more value with what their neighbor is saying or what their friend is saying. So that's where we are at this point. A lot of progress has been made, but we still, our vaccination rate right now is 55% of our total population. So there's more work to be done for sure. But does anybody have any questions, any comments? Or maybe we want to save those to the end, I don't know.
Yeah, I think we're gonna save questions for the end and kind of get insights from all three speakers. But certainly as a reminder, if you have any questions, please feel free to add those into the chat box or send them directly to me, Crystal Terhune. I should be listed on there as the question taker.
Great. Okay. Well, thank you very much, Janelle. And Cindy, are you able to get up there and yay. Well, let Cindy go next.
All right, that looks good.
All right, you were
Thank you. All right, now we're good to go.
yay.
So that was a great presentation, and what I heard was that we have a lot of the very similar challenges as well as strategies in Washington County. Washington County is located east of Frederick. We are made up primarily of high school graduates. They work in blue collar jobs. We have a lot of farming residents also. And we have a low number of minorities in our county, but it is growing. For Meritus, the strategy has really centered on increasing access to the vaccine and addressing the vaccine hesitancy concerns. And similar to Allegheny, we really wanted to focus on providing credible health information, and we utilized our healthcare professionals and trusted messengers within specific populations to do that. So, although we had many strategies, I really wanted to focus today on our mobile health clinic. And we were very fortunate in that when the pandemic was rolling out, we applied for some grant funding through the HSCRC, and we were awarded that. And the funds provided coverage for staffing and supplies and our new mobile health clinic RV that you see right here. We have lovingly named him Moby. And Moby has been doing a lot of running over the past months. Our focus is to reach out to the most vulnerable and the underserved persons in our county, because of course we had a mass vax clinic and the health department had clinics throughout the county, and also the hospital provided another mass vax location within their walls. So we wanted to get out to the folks that might have had some barriers in being able to get to any of those clinics for whatever reason. And up to this point, the mobile health team has administered 6,334 vaccines to children and adults in our county. Our goal is that we're going to hit or exceed that 7,500 mark by the end of June. So to increase access to the vaccine, we reached out to some old and then developed some new community partners. And the partners evolved as the pandemic evolved, and the response and support have been just overwhelming. The initial partners and advisors, and I'll name a few of them, I won't name all of them, but they included, of course, the health department, the Commission on Aging, the Western Maryland Consortium, the Chamber of Commerce, various churches, and the Asian American Center. And then that partnership has expanded to include providing clinics within convenience stores such as AC&T, Sheetz, the Dollar General, many churches, subsidized housing complexes, and many businesses such as Bowman, Certainty, Merkel, El Eden Market, the Redmond Club, and also a lot of the physician practices and schools such as our community college and the University System of Maryland and some of the private schools. Each partner offered various levels of support. You can see those levels of support listed here. When we plotted out our strategy, we used CRISP and the CDC Social Vulnerability Index to identify the most vulnerable and underserved persons in our county, and those at the highest risk for acquiring COVID and the least likely to have access to vaccination due to having the greatest disparities. Up to this point, we have established 90 different locations throughout 15 identified zip codes in Washington County. We've held 17 different community events and over 300 clinics. The strategies that we used to be able to achieve this is to really embrace the philosophy that it takes a village, especially in a pandemic. We identified the geographic needs, and then we had our community health workers survey folks, and there were discussions and outreach that we learned about reasons for vaccine hesitancy. And we were able to provide education through some of our physicians and our residents, our nurses, and our community health workers. We also enlisted those trusted messengers who were leaders within community settings. Many of the pastors were very supportive, and they would, during their church services, they would talk about the importance of vaccination, and they would invite a nurse and a physician to actually speak and ask and answer any questions that they might have. We've had pastors that actually went door to door in the neighborhood talking to folks about the importance of vaccination, and would actually bring them to the clinic that was located within their church. And of course, a lot of the business leaders were also trusted messengers and encouraged their employees to be vaccinated. Of course, all the vaccines that were offered at all the clinics were offered at no cost, and we offered them at various times and days throughout the week. On weekends and evenings, early mornings, we would go to warehouses and set up at 5 a.m. in the morning to get those shifts coming on or leaving. And one of the lessons that we learned was that we needed to keep moving. We could not have a stationary clinic for one full day. So we learned that we needed to have 2, 3, sometimes even 4 clinics within an 8 or a 10-hour day. So there's Moby again. So the mobile team consists of a nurse practitioner, an RN, and a community health worker. And they are very, very versatile, as you can imagine, going into warehouses, setting up outside at different events, going into churches. We've gone into nursing homes, and they've had us set up in their storage rooms. We don't care. We have a small footprint, and we can do that. Of course, in the warmer weather, we are outside under the awning of Moby, and that really makes us accessible for a lot of folks. The vaccinations are documented in the hospital's electronic medical record so that the information is included in the person's medical chart and accessible to all providers that care for them. We've also found that very easy to access. If somebody says that they have lost their card, we can bring that up. And we can always double check to see what vaccine they had and when they had it using the medical record. Our mobile health clinic has been recognized by the state as a top mobile clinic for booster administration. And we were asked to present, along with Johns Hopkins Mobile, our strategies and successes. MedStar has also met with us because they wanted to learn more about our strategy to set up clinics within convenience stores. So just to share a moment about that, ACNT is a locally owned convenience store. They're throughout all of those 15 zip codes that I had mentioned earlier. And one thing that ACNT is known for is their fried chicken. Now, that's not very healthy for the hospital to be promoting fried chicken, but we're going to take advantage of all of the people that come to get their fried chicken. So ACNT has welcomed us with open arms. We set up in their dining room, and when folks come to get their gasoline, get their bread, get their chicken, they can also get vaccinated. And that has been a huge success for us. Our biggest challenge, of course, has been the vaccine hesitancy. And we've approached this in various ways, but in all honesty, It really seems like the one-on-one discussions have been the most successful for us because we can share information that is needed for that particular individual. Many times our physicians come to the clinics and they are there to address any of the concerns that anyone has about whether or not a vaccine is something that would benefit them. All of our pediatric clinics are held within a pediatrician's office so that the parents have easy access to their child's pediatrician and can ask whatever questions that they might have prior to being vaccinated. It's also helpful because the pediatric staff know the child. And so if we need any help, we can certainly tap into them. And it's just a really good win-win for both of us. As mobile health work continues, what we expect is that the pediatric and the booster needs are going to probably increase. So we are working with various insurers to provide outreach to the unvaccinated. We too struggle with being one of the counties in the state of Maryland that have a low vaccination rate. I believe when we first started, it was around 30%, and now we too are at 55%. So there still is a lot more opportunity. But by working with Maryland Physicians Care, we let them know where our clinics are located, and they then send a message to their clientele that live in that area so that they can come by and get vaccinated. And it's been wonderful because they are also offering financial incentives for their clientele if they are fully vaccinated by a certain date. So between those two nudges, we are seeing an uptake in that Maryland Physicians Care clientele. Many of the pediatrician as well as the medical offices are planning on taking full responsibility for vaccinating their patients within probably the next few months. So we plan to continue our outreach to the minority population. We plan to still work closely with pediatricians with vaccinating children. The after hours pediatric urgent care has offered us space there where we are going to be going in there prior to their urgent care opening up so that we can be easily accessible and can offer vaccination to the community for the pediatric population. And we know that there are pediatricians located within running distance if we needed to, but they are going to be on call for us if the need be. So mobile vax will end up ultimately transitioning to providing primary care and preventive care to our underserved community after the grant period ends at the end of June. But we are still going to always be available for any type of public health need that might be arise. I think that a great thing with mobile health is that not only are the staff versatile, but the service can be versatile in responding to whatever the need is in the community. So I guess I will also hold for questions.
Yeah,
Thank you.
Thank you so much. Those are really great insights. And I think now we're going to transition over to Lisa, who's going to introduce Kendra for us.
Yes, thank you, Cindy. I'm glad we got that working and everything. So our Our final speaker, oh, she's got it up. Great. Our final speaker is Kendra Thayer, who serves as the Senior Vice President of Patient Care Services, the Chief Nursing Officer, and the Chief Operating Officer of Garrett Regional Medical Center. So she wears a lot of different hats up there in Garrett County. She's been with the hospital since 1993 and has gained professional experience in a variety of clinical nursing disciplines. She has a BS in nursing and an MS in nursing leadership and administration, and is a certified diabetes educator. Her healthcare specialty areas include cardiovascular and pulmonary rehabilitation and wound care. So we're happy to have Kendra with us today.
Good afternoon, everybody. Can you see my slides?
Yes.
Okay, just wanted to make
We're gonna
sure.
put it in presenter view. I mean, we're seeing your presenter view, so I don't know.
Okay. I might not be able to change that. I don't have that many slides, and actually,
Okay,
that's fine. Great presentation so far, and honestly, I can echo pretty much the same thing for here in Garrett County. With Garrett County, we are the westernmost county in the state of Maryland and share many of the same challenges in regards to our rural geography, difficulty with transportation, access to care, getting residents to the care that they need, and share a lot of the same challenges that many of the other presenters here have spoken of. I put some of these slides together kind of in response as well from a hospital perspective, but as we move through the pandemic early on, I can't stress enough the importance that we have had with the collaborative relationships with the agencies in our county. We have worked very closely with the health department. In fact, as I'm listening to the other presenters, I'm sitting here thinking they probably would have been the better spokesperson today than myself. But we have worked very closely with our local health department, our FQHC, the school systems, the county government, and various area agencies throughout our county. Because of course, when the pandemic hit, many of our residents were very skeptic. They didn't really think COVID was real. It wasn't going to hit our area. We were, a little bit later having COVID cases hit Garrett County than the rest of the state. So I think that also created more of a barrier for us as healthcare professionals to reach our residents and really make them understand the importance of what was going on throughout the pandemic and how to deal with that. Being in a rural area, we had, some difficulty getting access to supplies. And that is also true in the realm of the vaccine administration, making sure that we were getting allocations of the vaccines that we needed for our community. We worked closely with our community agencies. The health department really took the lead on the vaccine administration and, just trying to work through all the shortages, realigning staff to help with vaccination clinics, offering what support that we could to our community agencies that were setting up the vaccination sites outside of the hospital, and how we could best help them prepare and get ready to vaccinate our residents. During the pandemic, as a hospital, we did a lot of reassignment of staff, and we set up testing locations, set up the monoclonal infusions. We were the only site here in our community to do that. So we did a lot of kind of the insider hospital work while still working very collaboratively with the outside agencies in our county to increase vaccination and to try to stress to our residents the importance of getting vaccinated to really prevent further disease progression. And throughout that, the hospital served as one of the storage sites for the vaccinations. We had the ultra cold storage capability. So we stored vaccines here for different organizations. And when the vaccines first became available, we did a lot of public relations to our community, showing our providers getting the vaccine, that it's safe, that it's effective. We did several videos that were aired on social media along with the health department and other agencies, showing the effectiveness of the vaccine, people in the community getting the vaccines, and their own providers delivering the message of why it was important, the safety of the vaccine, and how it would prevent disease progression, especially on those who had other comorbid conditions. And I still think we are dealing with some of that, stigma now with distrust in the health and distrust in the government and the reason behind the vaccines. I know one of the other presenters touched on that, and I think that's something we'll continue to have to work through. I think vaccines, in our community are definitely becoming more acceptable. We're seeing that in our rates of vaccination. And like the other speakers have mentioned, we're really trying to focus and target our vulnerable populations. The health department's done a great job with where they've established vaccination sites. Early on, they had a site right in the middle of the county. So it was easy for residents of both the northern and the southern ends to access that location. We provided vaccines here on site at the hospital as well as our 2 clinic locations, one in the southern and one in the northern end of the county. We used our community health workers to really target those vulnerable populations, address any of the social needs. If they needed help with transportation, we provided transportation for them. If they needed more information, education, we worked with them to try to get them to accept the vaccinations, and worked with the other clinic locations to make sure that we could get people to the vaccination sites to take advantage of that. And now we're still continuing to offer that, even if it's just going to the local pharmacies, because our local pharmacies, of course, have the vaccines as well, wherever they need to go when they're ready to get the vaccinations. I know the school systems have had a very important part of vaccination in our community. The school health nurses are working with the families and actively trying to get the families and the children immunized and really encouraging the booster vaccinations as well. And kind of, I think, really we have joined together as a community to show, the residents how important it is for the vaccines, and how through the outreach we can help, get the vaccinations to them, get them to the vaccination sites. And I know our rates have increased in vaccination. I was just looking on the site a little bit ago. For those age 5 and older, we have 51.5% that are fully vaccinated. And for those age 65 and older, we have 78.3% vaccinated. And that's a dramatic improvement from early in the pandemic when we had a lot of vaccine hesitancy. So we're going to continue now to really, I think, shift our focus to the boosters and really working as a community with our fellow agencies on promoting boosters throughout our community, hitting our pediatric population and getting that percentage increased as well. And I think as this continues to evolve, really looking at how we can assist our community in getting the vaccinations that they need. So like I say, I think maybe the health department might have been the better presenter for Garrett County today, but we work very, very closely with them in aligning a lot of our resources to support them, and as well as the school system and other agencies throughout our county. So thank you.
Sorry. Thanks, Kendra. I think that, it's good to hear from both parts because, as you said, I think in every county, the health department and the health centers are working together very closely. So it's like one big group along with others to work on and tackle this issue. So I just want to remind people, I want to just thank all of the speakers, first of all, for your time and sharing your experience and challenges that you've had. We can see there's a lot of similarities, but also some differences there and unique to each of the counties. So I really appreciate your time today to do that. And we're going to have some time now if people have some questions they would like to ask. If you would just put them in the chat box to directly to Crystal, she's going to moderate that question and answer part of this presentation.
Yeah, thanks so much, Lisa. For some reason, my camera isn't working anymore, but it seems like you can hear me.
Yeah.
So we'll just
We
move
can.
on this way. Technology, don't you love it? So thank you again. We have so many different insights, and I've got a few questions here. So the first question is a general question, so it's not geared toward any particular panelist, and it says, let's see, what have been some successful strategies to communicate the changes regarding the vaccine or the booster or the evolving, ever-changing COVID-19 situation, especially for populations that are harder to reach? So I guess the question is aimed about the communication of the changes that we experience throughout the pandemic.
Now, I can speak for Garrett. One of the things that we have done is a lot of social media, obviously, not only with the hospital, but with the health department. We also have went out to the communities, set up at libraries, senior centers, different locations where the residents are coming regularly to help interact and update them on changes with the vaccine and the efficiencies of the vaccine. I think we've really worked with our medical professionals, and as patients are coming for appointments, really encouraging and talking to them about getting the vaccine while they're there. Health department and the school system are doing exactly the same thing. So it's in a small community, word of mouth spreads pretty quickly, and really trying to decrease that stigma or kind of that negative connotation, and from the government perspective, pushing the vaccines that to show really how effective they are as we've gained more evidence over time.
Great, thank you. And were there any other comments on that question from the other panelists?
This is Cindy from Washington County. We really rely a lot on our community partners to help us with that type of communication, beyond the normal strategies for social media and such. But before we have a clinic, we will send our contact at the organization that we're planning to go the latest information, maybe about boosters or, the latest research from the CDC and such. And so they will have that they then can distribute to their populations. We also offer the opportunity for them to have a nurse or a physician come prior to the clinic, again, to communicate that similar information. And that seems to have been very successful. Our physicians here really enjoy doing that. In fact, our chief health officer even volunteered to go to a warehouse at 5 o'clock in the morning to be able to talk to some of the folks there. So I think everybody is behind the real purpose of vaccination, really knowing that that's what's needed to slow down this pandemic.
Absolutely. Thanks so much. Let's see, we've got another question here, and it says, what ideas might there be or plans might be in place in order to keep up the education efforts for the for the need to remain diligent in preventing infection now that the Omicron virus has slowed? The NRHA cites 95% of rural USA is still in the red zone. So remaining diligent in preventing infection now that Omicron has slowed down.
Just my 2 cents. And I think that where we're struggling right now is that the majority of the population are behaving as if we are out of the pandemic. Rarely do you see anyone wearing masks or holding on to their, disinfectant gel. even when you go to the grocery stores now, a lot of times you can't find the little wipies to wipe the cart, all those things that had come out originally. And it gets very frustrating. And there is a need to be able to continue to communicate not only the importance of vaccination and boosters, but also to mask and to continue to social distance. So, I mean, from the hospital standpoint in Washington County, we're going to continue to promote these things via the social media. We've had physician panels discuss it. And we're supporting our physicians in their offices with whatever information they would like us to provide to them, even if it's flyers that we can distribute to the practices for them to have available for their patients.
Okay, thank you. I think we have time for maybe one or two more questions. One of the questions is, have you had challenges within your medical community with getting vaccinated? Just in general for any of the three of you.
Hi, this is Janelle. Oh, sorry.
Go ahead.
I just would say that that is not something we've experienced. I think our medical professionals in Allegheny County have been on board from the start, by our side, promoting vaccination and really doing their part to increase access in our community. That has not been a challenge for us, and we do what we can to support them by being our vaccine hub, getting information out for them. That's a group that we have not had to work on convincing. They are already there.
Okay, Cindy, were you going to add to that? I mean, not Cindy, Janelle.
No, that's all.
Oh, okay.
I think Kendra was going to respond.
Oh yeah, Kendra.
Yeah, I was just gonna also add, I mean, we did struggle with that a little bit here in the hospital. I can speak of, our physician medical staff was all on board. We did have some difficulty with, believe it or not, our frontline staff, and we had some challenges to overcome with that. Not sure if they felt that they, had the super immunity and it wouldn't affect them, but over time we have, through education and really working with them, we had some vaccine clinics, and that has shifted. It took time. It wasn't an immediate response for us, and it really just takes a lot of talking, reinforcing. We had one-to-ones with providers to try to, answer any questions, especially about their own medical conditions that they were struggling with, and should they get the vaccine or not. It was time intensive, but was successful in the end.
Okay, and one final question is, our program operates peer-run wellness and recovery centers in all three of the Western Maryland counties. Recently, we were informed of additional BHA funding available to increase vaccinations. What is the panel opinion on financially incentivizing vaccinations in the current opioid epidemic?
I'll take that one. It's
That's a
difficult.
tough one.
I understand the hesitancy there, but there are other ways to incentivize besides cash. There are things like gift cards and other incentives that could be useful and beneficial to people that wouldn't be handing out cash if there's concern about that. And that's something that has happened in Allegheny County. It wasn't through the health department, but another local organization has been doing $25 gift cards to incentivize people to get vaccinated.
Yeah, it's really interesting when we have so many things going on at the same time, and always having to think about how one effort could impact another effort as well. It's great thinking. Okay, Lisa, I'm not sure if you had any other announcements.
No, well, we are going to have another webinar that's going to be talking about working with migrant farm workers in late March or early April. So if you would like to be added to our mailing list, we send out newsletters monthly and also updates and invitations for our webinars. So If you would like to be added to that mailing list, please just put your email in the chat box and we'll be happy to add you and keep you up to date with what we're doing with our Excite activities. And I really appreciate everyone coming today, and especially our 3 panelists for sharing what strategies that you've been doing. And you've all been very successful in Western Maryland. It's been a challenge, I know, and I just congratulate all of you for the hard work and the perseverance to go through this pandemic and see the other side and seeing successes. So thank you. Bye.
With that said, thank you all so much. Thank you to everybody for joining us. We'll leave the chat open for a few more minutes in case you wanted to get your email address in there to be added to our list. But thank you, and we hope you have a great rest of the day. Take care.